Thank
That's
you.
the way to do it.
But I got you.
Oh, okay. All right. Thank you.
Thank you, Sam. Fantastic.
Okay.
I really. Hi, Sam. I haven't seen you in a long
Agenda,
time.
agenda, you have an agenda? Sheila? All right. Okay, good. You ready?
Yes.
Come
Oh, come on.
on in, Luce. Good morning, everybody. Sorry for the delay. As you all know, we have a big public works meeting next door, and thank you to these 4 county board members who are not on this committee for participating today. So under the authority of the county board rules, I appoint members Sheila Rutledge, Lucy Chang Evans, Sam Tornatori, and I can do 5, can't I? And Liz Chaplin to serve as temporary member of this committee to establish a quorum. So, all right. Karen, please call the roll.
Okay, I have to fit alphabetically. Member Chang Evans.
Here.
Member Chaplin.
Here.
Member Rutledge.
Here.
Member Tornatori.
Here.
Chair Swarzy.
Here. Thank you very much. Do we have any public comment?
No public comment.
Okay. We do have quite a few people here because we have a presentation, but I'm going to hold off just for a few more minutes to see if our vice chair is able to make it in here to participate. I want to talk about texting to 211 first. So I am pleased to announce that county residents seeking health and human services assistance can now do so by texting our 211 line. Texting 211 will initiate a conversation with a live, specially trained operator who will efficiently connect residents to the right resources. By simply texting their zip code to 898-211, residents can receive referrals to assistance available near them. While texting 211 is currently only available from 8 a.m. to 6 p.m. Monday through Friday, residents seeking help can still dial 211 or visit 211dupage.gov to find services 24 hours a day, 7 days a week. By expanding the 211 helpline to include texting, we're improving our ability to connect residents with resources and support, bridging the gap between struggle and solutions. We will be distributing a press release later today, so I hope everyone can help spread the word about this exciting new feature and help and the help it will provide our residents. So, and then to speak a little more about it is Jennifer Comas. So come on up, Jennifer, and share your information. And if you have questions, she'll be able to answer.
Good afternoon, or actually good morning, everyone. My name is Jennifer Comas. I am with Intake and Referral. I'm the coordinator over the 211 DuPage phone line and now the new texting service that was just launched yesterday, April 1st. We do have specialists waiting live at this time. So if anyone would like to try texting 898-211, it is your gateway to connecting with essential health and human services resources. They will ask a few statistical questions such as age, gender, zip code, and they will use that to find relevant resources for the person contacting us. So if
I
anyone.
need a volunteer. Who wants to volunteer
Anybody
to
want to
text?
try?
I'll volunteer.
Okay, it's just 898-211. And I recommend that you go in your phone's contacts and add 898-211 as a contact or a favorite. That way, right away, you can text back and forth when you need resources. If any texts are received outside of the business hours, they will get back to them first thing the next business day.
Wanna
Yeah.
move ahead and I'll.
Yeah. Go ahead and text a zip code.
I did.
Okay.
Oh, my zip code?
Yeah, like 60187.
Okay. It didn't ask me to do that. There we go. Thank you for texting 211 DuPage. Texting services are available on business days. A specialist will respond during those times. Please respond with your gender, your age, and why you're texting today. To stop to opt out. So I'm going to stop at this point. Is that
Yes.
correct?
At any point, you can text stop, unsubscribe, quit, and it will end the conversation.
So with that response, if she responded, I'm female, such and such, and the services I need, she will continue to get responses.
Yes, relevant responses, based on our resource database.
Nice. Thank you, Jennifer. Any questions?
The gender, sorry,
No, please.
I'd like to ask a question. If they don't want to reveal their gender, do they still get services?
Absolutely, absolutely. So they could put like an X or a no or something like
Or
that.
MFT or
Oh, I
O,
see.
so it gives
Okay,
you
good.
not just male, female, so.
Any other questions for Jennifer? Thank you very much.
Thank
Very
you.
exciting.
Thank you.
Thank
Good
you.
stuff.
Okay, I am now going to introduce from the DuPage Care Center, Annabelle Lomadia, along with a representative from Telegen, Sarah Friel. So come on up here. If you guys can come over here so people on TV can see you. And Annabelle, are you gonna start? Okay.
Well, first of all, thank you for that introduction. My name is Sarah. I'm a senior quality improvement facilitator with Telegen. And Telegen is the Quality Innovation Network Quality Improvement Organization. And if you would allow me to just give a few minutes about who Telegen is, and a little backstory about why we're here today. Telegen works to support the Centers for Medicare and Medicaid Services, CMS, to implement the key elements of the Department of Health and Human Services National Quality Strategy and Federal Healthcare Reform. And we do this by collaborating with nursing homes, with other healthcare providers, with community organizations to implement quality improvement initiatives. So Telegen provides technical assistance to over 1,500 nursing homes in our network. So that's the states of Illinois, Iowa, Oklahoma, and Colorado. So you might say, what is technical assistance? So what does that mean? That means that we provide nursing homes with support for data analysis, for quality improvement coaching, for implementation of best practices, and useful tools and resources, as well as education on topics such as the 5-star quality rating and quality measures, just to name a few. So some of the examples that we provide for nursing homes is support with things like medication safety, or reducing unplanned emergency department visits or hospital readmissions, as well as things like fall prevention or reducing pressure injuries and infection prevention. And so that's why I'm here today, is to talk about infection prevention, specifically as it relates to COVID. So during the height of COVID, we know the impact that had on nursing homes, just like DuPage Care Center. They felt the impact of COVID on their residents, on their staff, and the overwhelming burden that COVID placed on an already very busy workload. So in response to that, Telegen created a Blue Ribbon COVID-19 Vigilance Award. And what this award was intended to do was to really support and recognize nursing homes for all of their hard work as it related to creating policies, developing new protocol, and implementing a robust education program for staff, for residents, and even families. Now, today, the impact of COVID is not what it was years ago, but nonetheless, nursing homes must continue their diligence on preventative practices. Therefore, in 2023, Telegen introduced the Best-in-Class Recognition Program. Again, recognizing nursing homes for their ongoing commitment to quality and safety in resident care. Now, the Best-in-Class takes that Blue Vigilance Award kind of to the next level. It raises the bar a little bit. Nursing homes are still required to implement all of their practices that are necessary to achieve the Blue Ribbon, but there are 3 additional requirements that nursing homes must do to qualify for the Best-in-Class. So those 3 things are to complete a facility emergency preparedness assessment. And part of that assessment really addresses the response to pandemics and outbreaks. The second requirement is to ensure that at least 75% of the staff have been trained in comprehensive infection prevention and control practices. And then the third qualification is to demonstrate a reduction of at least 5% in emergency department visits, or to place in the top 25% of Telligence enrolled nursing homes. So I'm happy to say that in 2024, Telligence recognized only 76 nursing homes within our network, and among them is the DuPage Care Center. So today I want to present the DuPage Care Center their best in class. And also on behalf of Telligence, to just say thank you to all of your staff, this great representation of staff, to your ongoing commitment and dedication to the safety and well-being of your residents. So congratulations.
Thank you so much.
Wow. We have gotten a few awards lately.
Just a few,
A
yeah.
few. Within the past years, we have gotten a few awards. So I came from the Philippines, and in our little town in there, through social media, my dad heard about like, oh, another award. And he asked my mom, and he said, what do you think that award is for? And my mom said, she probably took care of some old people there. That she do well, that she can. I'm like, that's just exactly what we did. Patient-centered care. A lady right there asked me, what is this award for? I said, we just did a good job. That's all. I mean, I'm not gonna bore you and telling you the percentage and the numbers and how many were vaccinated and how many was sent to the hospital and all that. I mean, it's just that we did a good job. So, COVID changed the lives of so many people. Back then, before the vaccine, COVID is like a death sentence. We have a very, very strict COVID protocol. I have here our COVID nurses. You have Ambika, who is our frontline COVID nurse, dedicated COVID nurse. And we have Luz Gonzalez, where are you? Who is our dedicated COVID CNA. They're very fearless, going into the COVID unit looking like an astronaut, coming out of there, looking dehydrated, drenched in sweat and everything. And they just did that to take care of our residents. We have Vinny Patel and his team, who is constantly disinfecting, common areas, high-touched areas, making sure that everybody that comes in wipes their feet before they come in and everything. We have Jonathan and his team, who is dispensing Paxlovid, making sure that, our COVID patient takes it. We have Heidi Bohan and her team, who is making sure, encourage everyone to vaccinate. If they refuse, they will come again after a week. And then if they refuse, again after a week. Mario and his team was making sure that our COVID nurses go in the COVID unit with a full stomach. I mean, it's just so many people to thank for. The care center used to be a part of the heart failure program of Northwestern Hospital. That was before the pandemic. So I usually go there, and the goal is to prevent hospitalization and everything. And I'm always very proud if they ask me, what is the rehospitalization rate of heart failure at the care center? And I always say 0. And until this point, it is 0. That is because of our dedicated nurses who's making sure that we monitor the signs and complications of heart failure and treat them before, it comes to the hospitalization phase. We used to do this meeting at Northwestern. Before I leave Northwestern, I said, let me go and pass by Mary here. Mary is our resident that was admitted there. And then she saw me, and then she said, oh, here comes the big boss. Take me with you, will you? Take me with you, will you? And I said, why, Mary? You just need another test. Oh, you guys can do that at the care center. They don't give me my cocktail here like Nurse Ann did, Cocktail, 60 cc cranberry, 60 cc prune juice with 30 cc of milk magnesia. And they don't turn me like Nurse Gill does. Nurse Gill count on 3. In here, they just turn me in like a log. So I'm like, thinking, oh, this is really big deal for them to be here. I mean, they'd rather be at the care center. So I'm like, let's just strengthen our sepsis protocol. So to prevent, hospitalization such as this. And then she said before I left, tomorrow is Friday, Night of Columbus is coming. It's $50 for a coverall. She's talking about her bingo now. I really wanna attend that. You guys should sponsor that one of these days.
Love it.
It's really big. So, our recreation department, are looking for, activities such as this to make the stay of our residents very colorful. So, this award is a recognition for us. They see us, guys. This is not just, we're doing our job and doing our patient-centered care and everything. People do see us now. So we just continue, our good work. Lastly, what Barack Obama had said, nursing is the beating heart of our healthcare system. Well, the care centers, nursing is also the beating heart of the DuPage Care Center. That heart is really, really strong right now. But without the other departments, that can go easily weak. That can weaken very easily. So thank you. Thank you so much for this award. This means a lot to us. Thank you.
I'd like to open it up to the committee and the other board members to, if anyone has any comments. Vice Chair Garcia.
Congratulations to everyone, well deserved. So this is just, your facility and the staff there is just fantastic. And all I hear around the county is how wonderful you are. And when I go there, I see it in person, and I thank you so much for all your work.
Thank you.
Thank you. Anybody else?
This is
I just-
Janelle. I'm sorry.
Oh,
I'm not there in person, but I too, thank you, Annabelle, for speaking for the care center, and just a recognition for all the staff and all the hard work and the dedication. She really spoke eloquently and covered every topic. So thank you, Annabelle, and thank you everyone there.
Thank you.
thank you, Janelle. And I just want to say that, look, as county board members, we take a lot of pride in your success, in your successes, and everybody here. It's you guys that really make this place successful, and we sort of get to ride on your coattails, and our residents get to, live in a facility that is just so wonderful. So we're very, very grateful for all you do for DuPage County residents, and we're very proud. And just having all you people, all the employees here, the pride that you guys all must feel, it makes us proud as well. So thank you. And I would like to get a picture with the county board members.
That would be great.
Yes,
We can
yes,
get
so-
that worked out.
So thank you very much. And I'm just gonna, I think with the quantity of people, it'd just be these two
I
people
would
with
have
our,
to say,
with our
yes,
county
if
board
that would
members.
be okay.
Thank
So-
you.
So if I could have, so I'm gonna ask to part the sea a little bit over here, if I may.
You're out of here.
And then, and you need to be in it too, right?
Yes, you two are right front.
And then I'll have my board members, thank you, board.
I'm just gonna put this, I don't wanna be in
And I-
it, so I just want to get that out.
And I will.
Scoot this way just a little, this way.
You know, I'm not really on this committee, but.
Okay, it's okay.
You're a county board
See
member.
some smiling faces. I will, I guess.
Nobody wants to
Come on,
stand by
Don.
Greg.
Ina, Paula? Sam, did Sam?
Transportation.
Okay, ready?
Come on, Anita. Come on, Anita. Squeeze in here.
Shauna needs to go too.
One more.
One more, Anita.
So sorry.
You can go ahead.
There you go.
Thank you so much.
Thank you for your,
Thank you.
sorry we kept you late.
No worries.
I think that's hold it off.
Okay.
Oh, my God.
Otherwise, it's just.
You know, we're.
Gotcha. Thanks, Sheila.
We're done.
Now that, yeah, now that.
Paul, I'm glad you made it. We put it off till about, 10 till.
I was like, oh.
Oh, great. Thank you.
No, I just.
Yeah, get them before they all leave.
Yes, now
Okay.
that, Garcia, Galassi, and DeSarter back.
Okay, so let the minutes, we're back to business here. Let the minutes show that Vice Chair Garcia and members DeSart and Galassi are now present. And do I need to mention that we lost our other members? Good. All right. We are on to our approval of minutes, so I will take a motion to approve item 24/11/27, the Human Services Committee regular meeting minutes of March 19, 2024. We have a motion and a second. Any questions or comments? All in favor, say aye.
Aye.
Opposed? Thank you. On to community services. I'll take a motion to approve item FIR 6324, acceptance and appropriation of the 50th year of the Community
Second.
Development Block Grant Plan Year 24, the amount of $4,539,329. We had a motion and a second. Any questions or comments? All in favor, say aye.
Aye.
Opposed? Thank you. Take a motion to approve item FIR 6424, acceptance and appropriation of the 33rd year Home Investment Partnerships Grant Plan Year 24 in the amount of $2,011,683.
Second.
Any questions or comments? All in favor, say aye.
Aye.
Opposed? Thank you. Take a motion to approve FIR 6524, acceptance and appropriation of the 36th year Emergency Solutions Grant Plan Year 24 in the amount of $288,247.
Second.
Okay, any discussion? All in favor, say aye.
Aye.
Opposed? Thank you. On to DuPage Care Center. I'll take a motion to approve item HSP 1624, recommendation for the approval of a contract purchase order to Central DuPage Hospital Association doing business as Health Lab for patient phlebotomy and laboratory services for the DuPage Care Center for the period April 18, 24 through April 17, 25 for a total
Second.
contract amount not to exceed $40,000. Okay, we have a motion and a second. Any discussion? All in favor, say aye.
Aye.
Opposed? Thank you. Take a motion to approve item HSP 1724, recommendation for the approval of a contract purchase order to Bright Star Care of DuPage for supplemental nursing staff for the DuPage Care Center for the period April 13, 24 through April 12, 25 for a total contract amount not to exceed
Second.
$290,000. Okay, any discussion? All in favor, say aye.
Aye.
Opposed? Thank you. Take a motion to approve HSP 1824, recommendation for the approval of a contract purchase order to Nova Staff Healthcare Services, Inc. for supplemental nursing staff for the DuPage Care Center for the period April 13, 24 through April 12, 25 for a total contract amount not to exceed $500,000.
So moved.
Second.
Any questions or comments? Member you.
Yes, thanks, Chair. I just wanted to know, this is for supplemental nursing staff. Is it a different type of nursing staffing that they're doing for these two different contracts?
I believe it's more of a quantity issue,
I'm
but
on.
Janelle can answer.
Yeah, I'm on. I was actually going to talk about all of our agency staffing during my portion of report, but yes, it's difficult to get staff, so we use at least 3 as a rule, vendors. So you'll see us do budget transfers back and forth. So sometimes one agency is able to provide us a bunch of staff and it evolves and then they don't provide staff and another agency is able. So these amounts are set, but then we sometimes have to do budget transfers to move the money around depending on who can provide the staff for us.
All right, thank you.
Thank you. Any other questions? All in favor, say aye.
Aye.
Opposed? Thank you. Take a motion to approve HSP 1924, recommendation for the approval of a contract purchase order to RCM Healthcare Services for supplemental nursing staff for the DuPage Care Center for the period April 13, 24 through April 12, 25 for a total contract amount not to exceed $200,000.
So moved.
Second.
Any questions or comments? All in favor, say aye.
Aye.
Opposed? Thank you. On to travel, I'll take a motion to approve 24/11/28, a travel request for the Community Services Director to attend the National Association for County Community and Economic Development Conference in Tampa, Florida, from July 10th, 24 through July 16th, 24, expenses to include registration, transportation, lodging, and per diems for the approximate total amount of $2,979. Any questions or comments?
Comment
Yeah.
for them. Tampa in July.
Oh.
It's awful.
I'm
sure there's a pool somewhere
Uncomfortable.
around. Anyway.
Okay, roll call please for this.
Member Desart,
Aye.
Member Garcia,
Aye.
Member Galassi.
Aye.
Chair Swarzy.
Aye. Okay, under information, I'll take a motion to receive and place on file item FMP 1824, a recommendation for the approval of a contract to Builder Chicago Corporation for preventative maintenance and repair services for automatic and manual doors with threshold closers as needed for county facilities, for facilities management for the 2-year period of April 10th, 24 through April 9th, 26, for a total contract amount not to exceed $127,392 per lowest responsible bid. And I'll leave it. $30,000 is earmarked for the care center. Motion a second. All in favor, say aye.
Aye.
Opposed? Thank you. On to residency waivers, we have none. So DuPage Care Center update, Janelle?
Yes, hi. So I wanted to talk a little bit about agency. I have some charts that I can provide at another time, but we generally run around a 990, just under $1 million budget for our agency. And so since pre-COVID, the agency rates that we pay have skyrocketed. So what we used to pay prior to COVID is now $9 to $18 more an hour to an agency staff member. And that would depend on the shift, the day, whether it's a holiday or a weekend. And then there's these crisis rates. We were paying a lot in crisis rates just because it's so difficult to get staff. Annabelle's done a great job managing when we offer overtime or bonuses to our staff, when we use agencies. She's really done a great job managing that. We have had years through COVID where it was 1.2 million or more in what we spent in agency, but much of that went to ARPA. So we didn't see that financial impact. So now that she really cut down on when we're doing crisis, we're kind of stuck with the hourly rates we're paying agency, but obviously our goal is to reduce agency. So based on the first quarter of fiscal year 2024, we're on trend to be $100,000 under budget for our agency expense, which would be about $895,000. That's where we're trending right now. So this is a huge impact compared to running 1.2 or higher, whether ARPA covered it or not. We're looking at actual usage. So it's just something that facilities often have to deal with, and hiring has improved greatly. We were really struggling for nurses, and I think we've been able to hire quite a few nurses. We have been able to hire CNAs as well, but not near as many as we would like. If you remember the CNA tenure program, where Health and Human Services pays a portion of the CNA rate, so we're able to pay them up to additional $6.50 an hour. A lot of our competitor or other facilities in the area are doing that program too, so we're kind of back to fighting for the same people from a CNA perspective. But overall hiring it's done a 180. It has greatly improved based on our new contract rates. That's made a huge difference. Agency is never going to go away. And the goal, if you look back on years prior, I think since I've been there, our lowest year was like 600,000. Most of the time it's a million or so. So to be on trend for 895, we're pretty happy about that. What questions do you have for me on that?
Thank you, Janelle. Questions? Member Garcia?
I just wanted to say that I think it's great that, with the pay equity, that we're able to use the agencies less. So I think that's, I'm glad to see that we're able to have more full-time staff on there, and it sounds like they're happier. So,
Yep.
that's good.
And keep in mind, we're paying $895,000, but we're paying $19 to $18 more an hour. So if you would
Right.
take that into consideration, it is considerably less.
Yeah.
Because we're
Thank
paying
you.
so much more. Thank you.
Janelle, my question is roughly how many contract CNAs are we using per day compared to full-time staff?
It used to be like day shift would be 10 and PMs would be 2 or 3, and the night shift might be 1. And now we're running around 5
Okay.
6 on days. So that number is down to, we have a lot of, we have restorative aides for each unit. And when we don't have enough CNAs, they're pulled from doing, because their role is similar to a CNA, but they do a lot more with range of motion and movement and things like that. They are pulled into being a CNA for the day. So, we pull from our resources before we pay the high dollars.
Thank you so much. Any
Yep.
other questions? Okay, thank you very much.
Thank you.
As this committee will see that Mary Keating is under the weather today, so she is not in attendance. We don't have a community services update, but if anyone has any questions, Julie Hamlin is here to potentially answer any, community services questions, if anybody has any. Yes. member
I was just wondering if, that 11:30 CDC meeting is required for the whole board or just CDC members?
So it's open to the entire board. So the full board is a member of that committee. So
Right, but
your
is this-
presentation or your presence would be welcomed.
Thank you. But is this the mandated, the
It's the
required
mandated
one?
one, yeah.
This is the annual, yes,
The
required
annual
meeting.
one. Okay, thank you.
We'll see.
We were talking about that earlier. We couldn't figure it out. Thank you.
Thank you very much. Thank you, Julie. Do we have any old business? Do any of the committee members have any new business? I do, so, if anyone else has any, no, okay. So as this committee knows that we earmarked a little over $1.5 million for the Northern Illinois Food Bank to continue their produce and of course add the proteins to this program. What this committee did not discuss is the townships who had previously opted out. So I want to get a feel from this committee on how we want to proceed with that, because there were three townships, food pantries who opted out. One of them was Bloomingdale, who they weren't getting the delivery anyway because of logistics and things like that. So they obviously took the opt-out money because they were getting nothing. The other two were Addison and York. So this program, this new almost 1.6 million begins this month. So do we want to make a presentation to our county board to add additional opt-out money? Do we want to ask them if they want to get back into the program? Or do we want to do nothing? So, Member Galassi.
My feeling is, let's ask them to get back in. Although you said Bloomingdale wasn't receiving.
Bloomingdale is the exception because with the logistics of, and when Mary's back, she can answer these questions a little bit better. But they may have to take the money because they may not have the option.
Okay, so can we not get them the food? Is that the problem?
Yes.
Can I
yes,
answer
there
that
was-
question? I'm on.
Mary is on. Yes, go ahead, Mary.
So Bloomingdale so when we first started the contract with Northern Illinois Food Bank, we gave them, frankly, little to no money for the operations. The funds were strictly for produce. And so they delivered to pantries that were already receiving regular deliveries from NIFB. Bloomingdale wasn't on their regular delivery route because they weren't large enough to be sort of a regular recipient from NIFB. And so they were not added. They weren't added to the produce program. They were provided an opportunity to go and pick up the produce, as was any agency in DuPage, any partner in DuPage that was an NIFB partner did have the opportunity to go pick it up. Bloomingdale declined to go pick up the produce, and so they weren't participating at all. So that's why they weren't. We would have to talk to NIFB about adding them to the delivery route if that's the will of the board.
Okay. Member Galassi, thank you, Mary.
Thank you, Mary. I just feel like if we could get Bloomingdale added and we can get these others to get back into participation with this program, like, I just feel better about the monies being spent from that overall organization. They probably have better rates. That it is what they do. And, you know, I feel like they're gonna be the experts in it. So that would be my first choice.
Thank you very much.
I agree with Member Galassi. Opting in would be to reach out to him to opt in. What is the opt-out money that you talk about? If they opt out, they get how much?
Mary Keating did put together a percentage of money based on how many people they serve, how many tonnage of food they
Oh, so
use and
it's a
so
vary.
forth. So it does vary per township. Because we already approved the 1.5+ million, we have there's roughly about $500,000 left in food money that is in our 2024 budget. And so any opt-out money that we did choose to use would come out of that $500,000. But the numbers roughly, well, if all 6 townships opted out, it'd be roughly $108,000 of that $500,000. Addison is
Is that what you said?
108.
Eight,
108. Addison is roughly just 13,500. Bloomingdale is about 15,500. And York, who is the other one that opted out, is just under 9,000. So,
All right, and the third thing I wanted to bring up is that, I know that we're opening this up to traditional food pantries, but I was wondering about, we saw the Conservation Foundation in Stormwater this morning, and I know that they produce produce for food pantries in the area. Would they be an organization we could reach out to as well to offer them any help we could regarding transportation to food pantries or
funding of some
Funding,
sort.
yeah.
To be able to expand their program.
let me look into it. Let me delve into that. I don't know the answer right
I don't
now.
even know if they have any needs, but
Yeah.
if they're offering this, you know, huge amount of produce to various food pantries, maybe they need a truck, maybe they need I don't know,
Sure.
maybe they don't, but it's worth looking into, I think.
Thank you very much. Any other questions or comments about this? Member Garcia.
Yeah, I agree that we should offer them the opt-in, but my only concern is sitting through many meetings with them the last time is what their concern was that they didn't like the quality of the produce, which I didn't understand, and that's why they opted out. So I'm not sure they're gonna wanna opt in due to our meetings that we had last year. So if they decide to opt out, then we have to take
If we
that.
gave them that option.
Right, if we give them that out. So we could possibly just give them the option of opting in and then they'll have to just either do it with or without. Is that what we're saying? So that would be the consensus.
Well, that would be the next question, and Member Garcia is absolutely right that, you know, two pantries out of all the pantries that we delivered to, had issues with their food and that's why they chose to opt out. So that was Addison and York. If they say, no, we don't want to continue this program, would the next step be to offer
That
them?
problem was solved, wasn't it?
Well, I gave them the sorry.
No, please speak.
We gave them the opt-out last year because they were in the program. And so we gave them, instead of delivering the food, we gave them the money instead. Now we've just approved just giving the food with no money. So it would be.
Currently, they're not, as of this month, when the new money really starts, they are not in the program at all.
Right.
So what's your thoughts on, please?
This is a hard one for me because I don't want to leave them without food.
Correct,
For sure,
correct.
but at the same time, I don't want to be incentivizing people to be opting out. So I don't know. I feel, and if you guys, how many food pantries did you interview? Or talk with?
All the townships.
40?
And the only 2 had complaints. See, that's why it's just, to me, we're incentivizing the wrong thing. I mean, if 38 said we're getting great produce from this expert organization and 2 are kind of on an island, I feel like you gotta get with the program. That's kind of where I'm at.
And I'm not on the committee, I apologize, but
No, please.
I agree. I think treating everybody fairly and in the same way. Otherwise, you're gonna have people that are gonna maybe have a bad year that they didn't get exactly what they want. And then they're gonna like, I'm opting out. I want the money,
Right.
versus let's stick with this, Not every harvest is the best harvest for plants. I mean, we can't really deal with that.
Okay, so the consensus I'm feeling is let's offer them to hop back in to the program and we'll work on Bloomingdale because now we're doing, now we're paying it, some of that money is administrative. We'll see if we can get them on a route. And we'll sort of leave it at that at this point. Yes.
Yes, you know, to incentivize them to opt in, we should probably listen to their concerns first about how to get them adequate produce. It's not.
We did, we had multiple.
I
meetings.
remember this. I
Oh,
thought
okay, we had multiple
That's why I
meetings
said
with
I
them.
thought we solved that problem.
Well, we did, they
Got
opted
them.
out, they opted out,
Oh, that's the way, that's how it was
That was
solved.
the
And we gave
solution,
them
yeah.
cash.
they gave them cash.
That's how the problem was
I
solved.
really feel that this
you know, I'm with
500,000
Member Galassi that, I'm with Member Galassi that we've got to figure out how to serve them better then. If they're just the two islands out there saying we have bad produce, we've got to figure out how to get them.
Well, I will direct Human Services to reach out to the pantries and ask them if they want to opt, if they want to continue to participate or re-participate. And we'll see their answers, and I'll keep this committee updated on it, so.
Did you happen to see the produce?
They didn't have people go up and look at the produce,
And was there an issue with it?
not that they saw.
Okay, all right, so it's. an
Well,
thing.
and I will say, you know, produce is very temperamental, so to
It is,
speak, you
yes,
know, I mean,
yes,
you are
yes.
gonna get, and
You're gonna
certainly
get a bruise.
pantries probably all across the county
Yeah.
probably got some portions that maybe weren't, you know, usable. But I think the majority and the feedback that we got, that Vice Chair Garcia and I got from the majority of the pantries was, we understand that there's a, I hate to use this term, there's a throwaway percentage, and I can't remember what it is, you know, 10% or something, maybe it's not that high. But,
Just like your own
but they,
You know, I would say, I would say that
That's
after
what
the
it is.
pandemic, I mean, the produce is not the same. It's like strawberries, for example, used to last a week in my fridge, and now it's like 2 days later, they're molding already. So I mean, produce across the board is not the same as it was before the pandemic.
So, this is fresh stuff, so, well,
Well,
that's
supposed
not,
to.
I should say my garden.
Supposed to be.
okay. Any other discussion on this? Mary, I hate to bother you because I know you're not feeling well. Do you have direction on this? Based on our conversation?
Yeah, it sounds like you'd like us to reach out to the three that opted out before and ask them if they want to join the program. Is that correct?
Yes.
Okay,
Thank you very much. Thank you.
Feel better?
thanks.
May I?
Yeah, please.
Service updates, I apologize.
Oh, sure.
Okay, so we do have a minor update Mary would like me to let the board members know about. So, but it is CDBG's 50th anniversary, and the celebration is technically April is now a community development month because of this 50th anniversary celebration, and then HUD is also going to be highlighting CDBG in August. Community Development Commission in DuPage County, we are doing a social media campaign. So we are going to be putting forth project spotlights of some CDBG infrastructure, capital improvement, public service projects that we've done over the past couple of years. And we're also going to be, we have reached out and we were doing testimonials from communities, nonprofits that have received CDBG funding for them to talk about the benefits that they've had to the community. So just want to share that with you. That should be starting this month, and we're also doing it throughout the year just to highlight CDBG in general for this 50th anniversary year. That's all.
Thank you. Thank you. That's awesome.
Happy 50.
All right. Thank you, everybody. Any other new business? Take a motion to adjourn.
So we'll.
All in favor, say aye.
Aye.
Opposed, say no. Thank you.